followed by Dr. Michael Caldwell, Director of Public Health. Also speaking today are Interim Chief John Drake of the Metro Nashville Police Department and Dr. Tama Vandekar, Chief Medical Officer at TriStar Health. We're joined this morning by Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, who is here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Over the weekend, Metro Police, Metro Legal, Public Health, the Beer Board, the Fire Marshal's Office, Metro Codes, Transportation and Licensing, the District Attorney's Office, and Hub Nashville collaborated effectively in an increased enforcement effort in our downtown core and midtown areas. Local media has reported widespread adherence to our mask ordinance in recent days. Metro personnel will maintain an enhanced presence and enforcement campaign to keep our residents safe so our local economy can reopen. Now, since Friday, MNPD officers have issued 42 citations and made 4 arrests for violations of Metro's mask ordinance. Public Health has issued a total of 68 civil warrants to establishments across Davidson County for failure to comply with Metro's public health ordinances. As announced last week, Order Number 10 has prohibited the open consumption and possession of alcohol, as well as all to-go sales of alcoholic beverages in certain areas of downtown and midtown Nashville. This is to prevent the kind of crowding that facilitates rapid and widespread transmission of the virus. Now, representing our city's enforcement working group this morning is Interim Chief of Police John Drake, who will provide an update on Metro's mask enforcement measures. In a public health crisis, we can treat patients once they become sick, or we can use tools, including masks and social distancing, to keep our residents out of the hospital in the first place. And I'm grateful to all our partners for their dedication to enforcing the law as our community responds to the COVID-19 crisis. The best way to help our frontline healthcare providers is to keep our coronavirus caseload in check. Wear a mask, help our nurses. As of this morning, Nashville's 14-day new case rolling average remains in the green at 194, down from 219 at our last press briefing. Last week, Metro Public Health began tracking a new metric, the 7-day rolling average of new cases per 100,000 residents. This allows comparison for virus spread with other counties and other states, as this particular metric has developed into a national reporting benchmark. Nashville is currently at 28.3 per 100,000 for our 7-day average, up from 26.3 last Thursday. Now, our goal is less than 10, which would allow our residents to freely travel and work without restriction across the country. And that would also remove Davidson County from our own state's list of counties with an unacceptable COVID-19 infection rate. Nashville's transmission rate has seen another low, a record low at 0.80 as of this morning. However, our 7-day positivity rate has seen an uptick to 13.2%, up from 11.5% last Thursday. Nashville's positivity rate before the June surge was at or below 10%. Now, today's new case number is 114, but yesterday we reported 287 new daily cases. Over the past several weeks, I've used the word fragile to describe the positive trend that Nashville is experiencing with our COVID-19 numbers. And I use that term because it describes the tenuous nature of our current public health trajectory, one that is easily reversible without continued vigilance and public participation. Nashville's COVID-19 response is a collaborative effort that includes our residents, business owners, local government, and our out-of-town guests. We must work together to further slow the spread of the coronavirus. This will allow us to fully reopen our economy, allow our children to return safely to in-person classes, and restore a new normal throughout Davidson County. Now, this morning, I want to welcome Dr. Tama Vandekar, Chief Medical Officer at TriStar Health, who is here today to remind us of the need to practice healthy habits and avoid the temptation of letting down our guard as our COVID-19 numbers begin to show signs of improvement. And since he is not here to object, and I know he is watching from his family vacation, I want to take a moment to thank Dr. Alex Jahanger for his selfless and tireless efforts, all as a volunteer, during these difficult moments. This is our 72nd COVID-19 press conference since March 8th, and the first press conference that he has missed. The city is fortunate to have this Vanderbilt doctor and MLK grad to make sure we are making the very best public health decisions for our community. Remember, Nashville, don't share your air. Remember to wear a face mask. When you're in public spaces, keep 6 feet of distance from others whenever possible, and practice other healthy habits to keep yourself and others safe. And I'll now turn it over to Dr. Michael Caldwell, the director of our public health department.
Thank you, Mayor, and good morning. Dr. Jahanger has a conflict with his schedule and will not be with us this morning. He will return next week. Here's an update on COVID-19 in our county. There are 2,928 active cases today in our city. This is the lowest it's been since July 1st. 86.5% of Nashvillians who have had the virus have recovered. This is the most it's been since the start of the pandemic. Our hospital capacity continues to remain stable. Today, 16% of floor beds and 12% of ICU beds are available. 166 patients are in Nashville hospitals due to COVID-19. Now, this is 25% lower than its peak last month. Last week, 10,900 Nashvillians were tested. About 1/2 of those tests last week were conducted at our community assessment centers. As a reminder, they are open Monday through Friday from 7 a.m. to 7 a.m. to 1 p.m. If you have any symptoms or think you were exposed to the virus, please get tested. And if you have any concerns about the virus, call our COVID Assessment and Information Hotline at 615-862-7777. The hotline is open from 7 a.m. to 7 p.m., 7 days a week. I want to thank all those who are working at the community assessment centers and working at the COVID Assessment and Information Hotline. Staff from Meharry Medical College, the Metro Public Health Department, and the Office of Emergency Management are working together with Hands on Nashville and other volunteers. Since mid-March, they have been there, on the phones and in the heat. It is truly inspiring to see their dedication to helping their fellow Nashvillians. I appreciate what they have done and will continue to do to help bring the information and testing to the public that is so much needed now. And I want to thank you as well. Thank you for doing your part in fighting this virus. It is going to take all of us working together. We need to continue to stay at home if possible. We need to continue to wear a mask and keep apart if we must go out. And we need to encourage and remind others to do the same. Thank you. Now, I'd like to introduce Interim Chief Drake.
Thank you, Dr. Caldwell, and good morning. A core mission of any police department is one we take very seriously, and that is to protect innocent citizens from harm. Traditionally, you think of police officers working to interdict criminal activity to prevent Nashville residents from becoming victims of crime, and that work remains vital. But as the COVID-19 pandemic has evolved, we find ourselves in a different role, trying to protect our community from disease. As the mayor and health experts have said, if anyone wears a mask or face coverings, we can lessen the spread of the coronavirus. In fact, orders from the Metro Health Department, which have the effect of law, mandate that all persons wear masks with exceptions, few exceptions. Nearly 4 weeks ago, we put teams of school resource officers on Broadway to enforce the mask mandate. We have issued thousands of warnings, and warnings are a good form of enforcement. Now, as of last week, we have begun a new phase of issuing citations, and in rare instances, arresting persons for failure or refusal to abide by the mask order. Since last Thursday, officers have issued 58 citations, made 4 arrests, and continue to warn hundreds of persons. I really do think the police department's mask enforcement on Broadway is making a difference. I know that Dr. Caldwell estimated compliance to be at 90% or higher, and as testament, I can agree to that as I walked up and down Broadway Saturday night and saw that compliance. Moving forward, the police department will continue to assist helping to enforce the mask mandate, not just downtown, but in other areas of Nashville as well, by officers who are on routine patrol. I want to thank our partners on the enforcement team, including staff from the Metro Health Department, Beer Board, Fire Marshal's Office, and Legal Department, as well as other Metro government agencies. Our police officers are members of this community too. They don't want to get sick, they don't want their families to get sick, and they don't want you or your families to be sick either. If the community will work with us by wearing a mask, the chances of us getting the coronavirus are greatly reduced. Speaking of our officers, the virus has impacted us as professionals as well. 49 officers has tested positive for COVID-19. Of that, 25 have recovered and returned back to work. Given the unique nature of our work, I want to thank Dr. Jahanger and members of the Metro Board of Health for last week approving an interim process to share certain COVID positive information with first responders that both helps protect the confidentiality of patients while also protecting the health of police officers, paramedics, and firefighters. Thank you.
Thank you, Chief Drake. I'd now like to welcome Dr. Tama Vandekar to the podium.
Thank you very much for the opportunity to be here today. It's a real privilege. I would like to first say that my message today is one of gratitude and encouragement. Thankful very much to Mayor Cooper and the leaders of this city for their right and appropriate decisions, some of them difficult, to ask us all to please pay attention to some small personal sacrifices that will have a greater good. We have a CEO in HCA Healthcare that calls them the 3 W's. Wash your hands, wear a mask, and watch your distance. When you think about it, that's not a lot to ask people to bring this incredible city back up. And how do I know these work? I know these work because this is exactly what we're doing in our hospitals and have been doing since March. And because we're doing that, and a broad foundation of what we're doing is those 3 simple things. We've been able to keep our healthcare workers safe, our incredible nursing colleagues safe. We've been sharing information back and forth with all of our health systems here in town. And because of that, as Dr. Caldwell said, we have capacity in our hospitals. We have healthy staff that can take care of patients. And this entire time, we've been delivering great, wonderful, happy babies to wonderful families. Because we've practiced what Mayor Cooper's asking all of us to do, we're now at the point that we're able to treat patients with debilitating pain and offer them knee replacements and hip replacements. We're at the point now where we can offer patients who have cancer the opportunity to have a surgical cure. We're at the place now where we can take care of patients who have COVID in our hospitals and at the same time take care of patients who have heart attacks and bad lung diseases. The reason we can do all this and have done this successfully and weathered the surges that we've had with COVID in our town is because we're following the basic mandates that Mayor Cooper, Dr. Jahangir, and everyone else involved is just asking you to simply help us do. And that is wear a mask, wash your hands, and watch your distance. And so again, I am thankful to everyone who's already done that, As a physician and a member of a health system, I can tell you it works and it's real. And so I would encourage all of us to please make this something we all do together. This city is too special to not come together and make this happen. And so I would, again, thank you for this opportunity.
Thank you, Dr. Vandekar. We'll now begin media questions. Let's start with Julia Palazzo at WKRN. Julia?
Good morning, all. Thank you so much. I have a couple of questions. Chief Drake, I know you touched on this very briefly, but can you talk more about the plan to patrol other areas as far as enforcing the mask mandate? Will there be officers walking, perhaps the Gulch, Midtown? Will there be ATVs in other places? And then two questions for the mayor. Some council members floated around the idea of turning Lower Broadway into a special event zone to help businesses stay open and safely operate. They didn't go too much into the plan, but I think it was similar to having, tables outside, kind of like other cities have done. Is this something you would consider and support? And then also, and I'm happy to repeat any of these if need be, the Nashville SC game that's scheduled for August 30th at Nissan Stadium, the MLS said they're going to be working with local health authorities to plan on limited capacity or no fans in the stands. So do you have that plan figured out with the league if fans are going to be allowed at Nissan Stadium on the 30th? Thank you so much.
Thank you, Julia. We'll start with Chief Drake.
Thank you for your question. And yes, we are going to have more officers in the Gulch area. We're increasing our enforcement efforts, although we see a great amount of compliance in Midtown. And then in the other areas of town, as far as South Nashville, we know, and other areas, we know of some problem areas where they've had crowded bars, clubs, and et cetera. And so we've sent teams out there and had, effective results in closing those particular establishments. What we're asking our patrol officers to do in those areas is when they see those, to note our command structure so we can approach those areas as well. So we can get compliance not only in the downtown area, but in other areas as well by using our patrol officers.
Thank you, Julie. The answer for your questions, more outdoor activities, obviously a good thing in the COVID era. The city would love to be able to facilitate that. However, there's always a however. We have to be certain that crowds or gatherings, even outside, are in compliance with public health orders. So let's get a grip on people wearing masks and behaving in all public areas. And then it also has to be done with the consultation of the businesses in the area and with their approval both in the thought and the execution of such a plan. And then for the soccer game later for this month, we'll be reviewing the plan with them. I had hoped, as we all did, that there would be better virus news. Right now, we're still at 28.3 per 100,000. Many states will quarantine people coming in and coming out of Tennessee. Our schools are closed. Our public schools are closed. And so in that environment, we're not going to make an exception for any activity until we get our public health in control. And currently, it would not be allowed under our metrics, of course, and we cannot engage in magical thinking that we will have a better virus condition in the weeks ahead, though, of course, we hope we do.
Nikki Junowitz at Fox 17.
Yes, hi, good morning.
Good morning.
This question is for Deputy Chief Drake, if he has a moment.
Yes. Go ahead. What is your question?
Oh, sure. A couple questions regarding the investigation, the allegations against Metro Police that came out late last week. It's kind of a two-part question. The first one is in regards to Captain Jason Reinbold. As we've reported, he had 3 assault cases opened against him from 2003 in Williamson County. In the spring, there was video that surfaced of him harassing a nanny in Brentwood. And now there are additional sexual assault allegations that came out last week. What is Captain Reinbold's employment status currently with the department? And what is it going to take for him to be decommissioned, if not at least demoted from captain? And then the second question I had is that my understanding is that out of the 300 some leadership positions within MNPD, only 19 of those are held by women. What effort is going to be taken to make those numbers a little more equal?
Chief Drake.
As far as the investigation for the sexual allegations, if there's going to be an independent arm with the DA and the Human Relations Commission that's going to conduct an investigation, we fully support any independent investigation. And once the results from those investigations, once they're forwarded to me, then I'll take swift action on what's needed. As far as Captain Reinbold, he's part of that investigation as well. And once we have the findings, we'll take the necessary measures with him, whatever that needs to be, whether it's through any sanction or more. As far as the women, I've been on the platform here recently saying that we want to increase our ranks of women in the police department. And only having 19 women is not a good measure. Had a meeting actually yesterday evening where I floated the idea of having an all-female recruit class. Also, we've had meetings with some of our female officers, and we're going to have them reach out to other women as well to let them see the allure and how good the police department is and the good things that we do in hopes of recruiting more. And not only by having more women on the police department, but that gives us a chance to have more women in the rank structure as far as the sergeants, lieutenants, and et cetera. So we're actually looking at improving that. It starts with recruitment. It starts with people that want to be a part of the department, and we're all for empowering women and having more women on the department.
Damon Mitchell, WPLN.
Hi, Chris. I have 2 questions. First, for Chief Drake, can you explain how the flex officers will be retrained and redeployed in the community? And the second, for Mayor Cooper, when did you first learn about the allegation from Ms. McClain, and why are you now just launching an independent investigation?
So I'll let Chief Drake answer that question. In terms of your question for the mayor, we made an announcement about that, which I'm happy to send to you again. The mayor has spoken with Ms. McClain. We've referred that to the district attorney's office, partly because, as you know, the district attorney's office can involve the TBI. That is something that the mayor's office cannot do. We've also involved Metro HR for thorough and independent investigation and review. We're now considering this a pending criminal investigation. And as a matter of policy, we're not in a position, the mayor's office is not in a position to comment on that any further. So Chief Drake, if you'd like to come up and answer that question.
So as far as our flex teams are proactive units that go into neighborhoods and try to suppress crime. And they do that by making traffic stops, making Terry stops, arrests, et cetera, field interviews, and at some point it can seem a little bit intimidating to residents. It seems like they're occupying a neighborhood instead of being a part of the community. That's how the report Driving While Black evolved, is that when you look at crime hotspots and you try to put officers in areas to suppress crime, you have more and more activity. So my thoughts are that we start community engagement teams, we reduce the flex teams, and we have officers meeting community members where they are. They go into neighborhoods, they talk to people, they see what their problems are, they help people. They have ice cream giveaways, they paint basketball courts, they feed kids, they tutor, they gain information from people to make their neighborhoods better. In fact, we had a resident in South Nashville, that area that had been plagued by prostitution and other criminal activities, where we cleaned the area up, and they sent us an email saying they felt empowered to keep it clean and that they feel their neighborhood is better and even safer. And so that's just our mission of just trying to reach people even better. And when you look at the downtown core and other areas that has a homeless population, we want to look at having quality of life teams. And where we don't want to criminalize homelessness, we want to actually help people. We want to connect them to services through the Homeless Impact Division, Salvation Army, Open Table, and et cetera, so we can help more and be more engaging to the community.
Brett Kelman at the Tennessean.
Hi, good morning, everyone. I want to revisit the issue of coronavirus testing. I think we are all happy to see some positive movement on almost all of the metrics by which we judge the virus. But as raw test numbers in the city continue to drop, I'm really questioning how you guys can have any confidence in these good metrics. I mean, I think we had about 800 tests today, which just raises questions about the sample size from which we're drawing all this progress. So I know we asked about this last week, but I want to reiterate if there is something that is driving the significant drop in testing that Dr. Caldwell or the mayor can speak to, if the city has any explanation for why so many fewer people are getting tested now.
Dr. Caldwell.
Good morning, Brett. I don't think it's a simple answer. I checked this morning on a team call. We have capacity to do a lot more tests than we're doing right now. I think part of this is that people are just not taking advantage of the tests that are available, or they may feel that they don't need to get tested. So we need to do a better job to try to get more people tested to the places where there is testing available, to get them to want to be tested. If they're not feeling well, they should go get tested. As we know, there's a spectrum of different symptoms. I checked this morning as well to see how many people that we've tested are asymptomatic, and that fluctuates between 15 and 20%. It's important also that anyone who's been a contact of somebody that's positive definitely get tested. So we have to look at this in a multifactorial way. We need to get more testing done. But let's take one step back and look at another metric that's very important, which is the attack rate, the percent of tests that are positive. This has gone down, except for the last week where it's plateaued and gone up slightly. So we want to do more tests to get that number below 10%. But we've got to get people to want to go testing, to go to get tested, to make sure that that testing is available. And there is good news that we are reaching out more and more to those at-risk Nashvillians. We're working with partners throughout Nashville-Davidson County to do extra testing efforts. We're doing testings on Saturdays and Sundays at churches. We're working with Meharry with the work they're doing in the African-American community. We're working with the Hispanic community. We're working with other multi-cultural communities throughout Nashville to find out how can we reach them, how can we test them, and we're doing that.
Ian Jong at the Tennessean.
Good morning. My question for Chief Drake is, what internal investigations are ongoing currently, and how many officers are being investigated, and are their duties being changed or restricted during the investigation? And then my question for Dr. Caldwell is, the Tennessee Lookout had a recent report about the number of COVID cases at construction sites, and it quoted the health department saying the city doesn't have authority to enforce health orders at those sites. Can you give some more details and clarification on this? Because that was contrary to my understanding about your authority as the health director. Thank you so much.
Thank you, Ian. So the chief will answer your first two questions, and then we'll turn to Dr. Caldwell.
They are reviewing the number of cases that's under investigation from the sexual assault allegations, and we'll get with the Office of Professional Accountability on the number that actually of officers that's being investigated. We don't have that at this time.
Yes, construction sites, Metro Public Health does have the authority to enforce the orders at construction sites. And, you know, construction sites face distancing challenges due to the nature of the business of employees working together on tasks. But the contractors have a responsibility to take measures to protect their workers and enforce the mandates of the orders, mask and social distancing, or to make arrangements to protect those workers in other ways. And Metro Public Health has reached out to several construction companies and provided CDC guidelines and explained those orders to them. Also, Fabian Bednay with the mayor's office led an effort to bring together several Metro agencies, including codes and Metro water services, who will monitor activities at construction sites as part of their regular duties. And if they see workers that aren't following the guidelines, then they can report those violations to the health department, and we will respond appropriately. So there are measures in place to address construction site and employees being protected at those. Thank you.
Stacey Case at Fox 17.
Thank you. Appreciate you all taking our questions today. Nashville is virtually the only major city not using either CARES Act money or raising money by leveraging corporate relationships to help prop up small businesses that the city has shut down. What creative plans might Nashville have to lock hands with our small business community to help them ride this out?
I'm sorry, Stacey, could you repeat your question one more time?
Nashville is virtually the only major city not using either CARES Act money or raising money by leveraging corporate relationships to prop up small businesses that the city has shut down. What creative plans might Nashville have to lock hands with the small business community to help them ride this out?
Mayor Cooper.
Well, Stacey, thank you for your question. I think it's all part of the fractured national response to the national crisis. Here we are acting with our limited financial resources in the CARES Act with this non-person CARES committee. I know that they will be closely examining small business needs. We are also spending a lot of time advocating with the state, which has a lot more CARES money resources, for them also to act to help small business. And then I will say your question about leveraging corporate relationships to help small businesses, I guess I'm not quite sure what that means, leveraging corporate relationships. I think they may think that that sounds a whole lot like a tax on them, and we're obviously not going to tax one aspect of the business community to help even another aspect of the business community. But we want to hear from the displaced, challenged small business community about how we can help them. And again, in just to add to their problem to have such a confused federal response, which is the largest and most powerful source of responses to help, has been a challenge for us all these last weeks. To hear kind of an incoherent, jumbled, and mixed. I can't even tell you today what the federal government is doing to help individuals or businesses in this regard since the original CARES Act was passed. I know states feel challenged with an order that was issued over this weekend that they may or may not be able to afford to help with themselves. but I know of no state that frankly even really understands what that order is and its positive benefits. So we are the last resort. Cities are, the first responder and the last resort, and we stand as a last resort to help, but we do want to encourage the federal government to straighten out its response and to make it vibrant, and we want to encourage the state, which has, again, probably on the order of 60 times more CARES money than this city does, to make business recovery an important goal. It's public health, it's education, it's business recovery, and it's social safety net spending, that's housing security and food, all of which are critical priorities going forward.
Our final question today is from Joshua Cole at WSMV. You're on the air.
Hi there. I had a question for Chief Drake. With the mass citations downtown, is there data for exactly who's being given citations versus warnings? And then to ensure that there's no discrimination toward people of color who might be down on Broadway versus the homeless, and the homeless down there as well, versus people of not color. And then Mayor Cooper, just as far as schools go, since you're kind of saying that there's still talks about whether or not there would be audiences at sporting events, or even making downtown kind of an event area. Is there anything in those decisions going in towards whether or not we will be getting back to school sooner than later?
Chief Drake.
We have been tracking the data for the number of citations that we've issued. There's been a total of 58, and 49 of those have been Caucasian, 8 has been African American, and 1 Hispanic. And with our homeless population, we don't have the exact numbers, but they have been interacting with the quality of life team. So we have not arrested homeless individuals, but we have provided them with services.
And Joshua, thank you for your question I believe in regarding to reopening schools. It's very simple. Wear a mask. Wear a mask. We want schools to get started. Wear a mask. We have to reduce the disease level in our community today from 28 per 1,000, probably to around 10 per 100,000 people on a daily basis. This is the national metric. This is the metric that the state itself uses to identify kind of a dangerous level of transmission. So we know the job ahead for us to do. Advocates of non-compliance are unemploying people and keeping children from being able to come to person and to school in person. These are all goals. We as a county need to restrict our risk profile in allowing normal economic activity until we do get to an acceptable disease transmission rate as identified increasingly by other states and by our own state of this metric per 100,000. So let's everybody stay focused on that. Our recovery is very fragile at this moment, and people advocating non-compliance with basic health tools like wearing a mask are going to prevent our children from coming back to school in person. It is that simple, really. And so I'm grateful as we close out the press conference to all of Metro and our police, our wonderful police department, but 9 other departments in a coordinated response to get us to do what we know is the right thing to do. It's hard to do, but it is the right thing to do, and this is our path to getting our schools back and to our economy back to normal. And we should not accept non-compliance as anything other than people not helping our nurses, not helping our officers. And the police, our marvelous force, I mean, drunk driving went from something that was socially sort of acceptable, unfortunately, a couple of generations ago, to our police force and our public understanding how it needlessly put lives at risk. This is not any different than that. And our force responded wonderfully over a period of time to change social attitudes and to have enforcement be expected. And equally in this matter too, it is a public health risk that people will die over the lack of compliance, much less our children not having the educational experience that we want them to have, which is in-person attendance in classes. So we can all make it easier by understanding that non-compliance is simply setting us back as a city where we need to be, and we can get there.
Those are all the questions this morning. I'd like to thank Chief John Drake and Dr. Tama Vandekar for joining us today. The next scheduled Metro COVID-19 press briefing will air on Thursday, August 13th at 9:30 a.m. Thank you for joining us.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.net.